Welcome to our webinar today. On behalf of the REL Northeast Islands, welcome to Multi-Tiered Approaches to Supporting Mental Health in Schools, Promoting Digital Wellbeing and Preventing Suicide. Today's webinar will present digital well-being and suicide prevention, two timely and important applications of MTSS. Next slide. Great. All right. So actually, next slide, please, Shauna. Our session today is going to begin with an overview of MTSS. We will then apply the MTSS framework to digital well-being and suicide prevention, followed by a Q&A session, and then we'll do a little bit of closing and next steps. But before we continue, next slide. Today's webinar is being hosted by the REL Northeast Islands. For anyone who is not familiar with the REL program, we are one of 10 regional educational laboratories across the United States. The REL program is funded by the Institute of Education Sciences at the U.S. Department of Education. Our region serves the 6 New England states, New York, Puerto Rico, and the U.S. Virgin Islands. The RELs partner with educators and policymakers within the region, including state departments of education, to help generate and apply evidence to improve student outcomes. We do this by conducting applied research, providing training, coaching, and technical support, and disseminating actionable and creditable research evidence. We conduct our work through partnerships with each of the states and territories within our region. Next slide. All right. I am pleased to introduce the REL NEI team presenting during today's webinar, each of whom brings a specific expertise in today's topic areas. We have Tori Todd will be presenting the MTSS overview. Tori is a Training and Technical Assistance Associate at EDC, specializing in helping schools and districts design and implement effective MTSS frameworks. Tori brings extensive experience in translating research into practice through professional speaking, coaching, and systems-level support to strengthen student well-being and mental health infrastructure. Shai Fuchsman will be joining us to present on digital well-being. Shai is a senior research scientist at EDC and has expertise in youth mental and behavioral health, prevention, and systems-level approaches to student well-being. Shai leads research and technical assistance focused on applying MTSS to emerging mental health challenges, including digital well-being and the impact of technology on youth development. Finally, we are joined by Summer Albert, who is a senior prevention specialist at EDC, and she has extensive experience in school and community-based suicide prevention. Summer provides training and technical assistance to support comprehensive, trauma-informed suicide prevention systems, including policy development, staff training, and crisis response within an MTSS framework. Right, next slide, please. Okay, so here are our goals for today. I will mention the REL NEI has previously developed fact sheets and resources on using MTSS to support student mental health. So today is going to build on that foundation by applying MTSS to two specific mental health and behavioral topics, digital well-being and suicide prevention. So today, participants will gain an understanding of how to incorporate and coordinate evidence-based student mental health strategies into an MTSS approach. We'll learn about evidence-based student digital well-being and suicide prevention efforts and how they fit across school-based mental health systems. And we'll understand how MTSS can support students' digital well-being and suicide prevention efforts at the state and district level. All right. So before we get started, I just want to do a couple of housekeeping notes, especially for those who just joined us. We will be using the Q&A feature for any questions and comments today. So please feel free to post them throughout the webinar, and we will hold them until the Q&A period. In addition, our moderators will be sharing links to you via the chat, so you can keep an eye out for those. Live closed captioning is being provided today, and you can access that at the bottom of your Zoom screen. And the webinar is being recorded, and both the slides and recording will be made available on our website. You'll receive an email once those are available online. And then finally, at the end of the webinar, we'll provide a link to a survey. and we would appreciate it if you fill it out, as it helps us in designing and delivering future webinars. For now, I am thrilled to hand things over to Tori Todd, who will provide an overview of MTSS for student mental health.
Thank you, Sarah. So I am excited to walk you all through this overview of MTSS for mental health. MTSS is a framework that provides us with a way to move from isolated programs and services toward a more coherent system of mental health supports. It emphasizes prevention, early identification, and graduated levels of support based on students' needs. And it also helps us to position mental and behavioral health as core components of student success, not as add-ons to academics, but actually as part of the fabric of a more comprehensive system. So if we could go to the next slide. Student mental health needs vary widely, and it is difficult for schools to whack-a-mole strategies, so to speak, targeting individual students one at a time. What MTSS allows us to do is think about tiered supports, universal supports for all students on a tier 1 level, that support prevention of mental health challenges or of escalated behaviors and emotions, while also delivering targeted intensive interventions to the smaller number of students who may need them. So when we have this sort of a tiered data-informed system, schools are better able to identify student needs, align resources, and monitor whether those supports are working. Next slide. We like to use a metaphor of IKEA furniture to explain an MTSS. So imagine you pick out this beautiful dresser online, you drive over to IKEA and you buy it, you bring it home and you open the box. You don't have a dresser in front of you when you open that box. You have a collection of separate parts that will make a dresser if they're put together in the right ways. And that is similar to an MTSS. Many schools have the pieces of a functional MTSS, but unless those pieces are put together and is assembled into a cohesive system that all works together, then we really have this deep system in place once we can build it. However, like IKEA furniture, it doesn't necessarily come with detailed directions. We have to figure out how to piece some of these existing systems into a cohesive structure that serves this bigger purpose. So MTSS is not really a new program or a new initiative to put in place. It's really a framework and a process for organizing the existing supports that you have into a coordinated, effective system that serves all students' needs. Next slide. So here's an image that I think is really helpful. You can see all of these various supports that many schools have. Mental health and behavioral health supports like bullying prevention programs, social emotional learning curricula, school safety programs, supports for students who are unhoused, substance abuse prevention. You can read the rest of them on the screen. Many, many programs. And these arrows are all showing the interconnectedness of these programs. But when they remain fragmented, it can be hard. Staff members maybe don't have teammates to coordinate with, and so they're doing this work in silos. It makes it harder to ensure access for all students to these programs and the consistency and the effectiveness of the programs when they are left in isolation like this. Next slide. What MTSS does is it takes all of these various pieces of the puzzle and it organizes them into a unified system that has a clear structure and a clear purpose. So supports become intentionally aligned across tiers rather than operating in isolation. All of those separate programs that we have, we organize them to think about which programs are accessible for all students, which are accessible for just those who really need a targeted support. Students therefore receive the right level of support at the right time based on the needs that have been identified. And on this next slide, we're going to go to, we're going to see a graphic that really shows you how this all comes together. This image shows a triangle, and on the bottom, that blue level, the base of the triangle, is your universal supports. Those are programs and practices and policies that are for all learners across the school or across the district. Students on that tier 1 level who are still struggling, even with those universal supports in place, become identified through data processes and are then matched with a tier 2 intervention, a more targeted intervention specifically to address what they are struggling with. Data is collected there again, and then for students who still need additional supports, tier 3 involves intensive individualized supports to help that student. You can see that these tiers are also connected by data systems, as I've mentioned, by leadership, and by implementation supports like training for staff, like coaching, like strategies that are, shared across the school. This framework really emphasizes consistency, as well as coordination between different teams and different programs at the school or the district to work toward continuous improvement. So if we're going to apply it to mental health, we can go to the next slide. MTSS is often applied to academics, and you may be familiar with MTSS for an academic lens, but it can just as well be applied for mental and behavioral health. Mental and behavioral health strategies that are universal, like mental health literacy, skills instruction, really support students to engage more in school. There's a lot of evidence that connects an MTSS for mental health to an MTSS for academics and to more academic success. There are some students that experience additional risk factors. Maybe they experience trauma or chronic stress. They require more targeted support. And so MTSS helps us to balance our promotion, prevention, and intervention across varying levels of need. We're now going to go a little bit more in depth regarding the different elements of MTSS. So we'll look at tier 1. What you see on the screen here are some examples of tier 1 strategies or tier 1 supports that might be in place. Tier 1 really focuses on promoting mental and behavioral health for all students. The supports are explicit instruction, integrating well-being skills into content, and universal screeners. When we move into tier 2, we're thinking about things like small group supports or additional classroom-based supports. Typically in tier 2, we deliver supports in a small group setting. And the goal here is early intervention to prevent more severe needs from developing. And then on a tier 3 level, we support students that have significant or complex mental health needs with individualized interventions and wraparound services. This may also include referring out to external providers. On the next slide, this is going to show our process for helping students get matched with interventions. Schools use data and observation to identify students who need additional support. Those supports are matched to student needs based on evidence, hard data, as well as professional judgment. And over time, progress is monitored to determine whether the supports are effective or whether they need adjustment. The goal is not for a student to remain on tier 2 forever, but to receive tier 2 supports for a period of time with monitoring to then gradually release back to tier 1. That process can look like maybe a student support team. So if we go to the next slide, you'll see this is an example of what a student support team process might look like. Student support teams review data, they discuss concerns, they refer students to tier 2 supports or to tier 3 supports. And that collaboration is really critical to help ensure consistency and shared responsibility for student well-being, rather than it being one person's responsibility to identify students and match them with interventions, a team is working on this, bringing in parents, bringing in family, bringing in teachers to make sure everyone is working together for the sake of the student. Another key piece of an MTSS are these drivers. Leadership, a strong leadership is really important to the success of an MTSS. Leadership helps establish a shared vision and a commitment to student mental health. Then staff can buy into this process and understand how this system is really serving the larger vision and mission of the school and serving student outcomes. And in the middle column here, you're seeing that there's a driver of programs and interventions. They need to be selected to meet student specific needs. I like to use the example here of a doctor. If you go to the doctor with a headache and they give you a Band-Aid, yes, that is a medical intervention, but it's not a medical intervention that meets your need. So it's not going to help you. You're much better off with some Tylenol that might take your headache away. And so we have to be doing that same sort of matching process with our interventions in an MTSS. And the last thing I'm going to talk about in this section is the data-informed decision-making piece of an MTSS model. The MTSS model really relies on having multiple data sources so that we understand student needs from a comprehensive lens. That might include things like youth surveys, whether those are mental health surveys or behavioral surveys, screening tools, and student records. We're also going to look at data about the effectiveness of program interventions and whether the interventions that we're giving students are supporting their needs, as well as whether they're happening. That's the fidelity piece. Does the intervention meet our students' needs? Is the intervention happening consistently? And then is it working? Are we seeing the impact that we want to see? And that is part of how the student support team will examine whether the MTSS is functioning the way it should be. So that's our quick overview of MTSS. I'm going to hand it over to my colleague Shai, who's going to talk to us about applying this framework specifically to digital well-being.
Great, thank you so much, Tori. So as Tori described, MTSS is a very helpful tool for organizing your broader mental and behavioral health supports. As you all know, a lot of districts across the country, I'm assuming many of your districts, have been grappling with the best ways to support students' digital well-being. And I'm going to define that term in just a second. But basically, you've all been grappling with how to best support students' positive, productive, meaningful use of digital tools while at the same time supporting them from avoiding or preventing the negative consequences. And there's all kinds of different approaches to do that you all have all been trying out. So what we're going to talk about today is using that model that Tori just talked about to organize digital well-being strategies. So next slide. So first of all, I wanted to point out that we just published through the REL Northeast Islands, part of or funded by the Institute of Education Sciences, this fact sheet, which actually summarizes a lot of what we're going to be talking about for the next 15 minutes. So I encourage you all to take a look at this fact sheet. It's up on our on the web online. And it's a great document to share with your colleagues that, again, helps to organize these strategies into MTSS. So I wanted to make sure that you all are aware of this fact sheet. There's another one that Summer will talk about as well. Next slide. So first of all, why do we need to be thinking about digital well-being? Why is it important? And more specifically, what does the research tell us about the need to address digital well-being, or to put it slightly differently, what is the connection between social media and mental health? As the headline from the New York Times in the bottom corner of the slide says, this is a topic that everyone is talking about, but how to prove the specific connection between social media and mental health using research, using robust research studies, has been a little bit more challenging. And so the evidence has been a little bit mixed. But here's what we do know. First of all, there is research that has found some of the benefits of use of social media among young people. So young people are using and can use social media in a productive way to make connections, to express themselves, to be creative, to find support, to find and or offer others help. So those connections that young people make through social media are meaningful and are supportive and can support their mental health. Having said that, we also know that the harms that many of us are concerned about are also real and have also been documented by research. So just as there's positive attributions or positive outcomes related to social media use, there's also some concerns, including creating or exacerbating mental health conditions such as anxiety or depression, poor sleep. So those of us who have children, especially adolescents, we all know about this doom scrolling where kids are staying up late at night, just not even thinking about what time it is or what the responsibilities are. They're just going through TikTok video after TikTok video or going through the Instagram, and that is impacting their sleep. So even though they're doing it at home, it's impacting their performance at school. Cyberbullying obviously is a real concern. Negative social comparison. So seeing all your friends having fun, at the beach or at parties, and feeling like I'm clearly not having as much fun. I'm not as good as everyone. I don't have as many friends. And we also know that some of those comparisons are not even real because we always put our best selves out there, and maybe not even our most honest selves out there on social media. However, there is some conflicting findings, and that's for various reasons. First of all, some studies look at amount of time, so they look at how much time people are spending on social media as a result, as a predictor of mental health. Others look at quality of interaction or only look at more addictive behaviors of social media. So the measures are different across different studies. Also, different studies obviously look at different populations, different age groups, different genders, and there are just so many other contributing factors as well. So there isn't as clear, robust a set of findings as we would want there to be. But there's definitely enough to know that this is a concern, and that what we really all need to do is make sure that we are both harnessing the benefits that have been documented by research and also paying attention, addressing, preventing the harms. So next slide. And this is what gets us to the definition of digital well-being. When we're talking about digital wellness or digital well-being, oftentimes in the literature and the media, these two terms are used interchangeably. We're talking about the positive state of mental, physical, and social mental health that is pursued through intentional, authentic, balanced engagement with technology and other kinds of media and interactive media through technology. So we're looking at the balance between the benefits and while reducing the negative impacts of digital well-being. And really, for the rest of my presentation, as we talk about strategies, we're talking about strategies that do exactly that, that help students to feel more connected through authentic and balanced use of digital tools, while at the same time also reducing and preventing the negative consequences. Next slide. So the question is, why specifically use MTSS? Why bring the MTSS framework to digital well-being? So obviously, Tori gave a great presentation that talked more broadly about why MTSS is a good framework for social, emotional, and mental behavioral health supports. That's true in general, and digital well-being being part of these efforts is also benefits from this approach. But specifically, one of the things that MTSS provides in the context of digital well-being is it provides that supports at different levels for students. So all students have access these days to technology. They all have, most young people are using social media. So all of them can benefit from supports that promote digital well-being. But at the same time, we know some young people might be struggling more than others. They might be spending way more time than others on these tools, or they might be struggling with mental health, either pre-existing mental health conditions that interact with their use of social media, or they might have negative consequences of the actual use, such as being victims of cyberbullying. So we want to make sure that we have those different levels of support when it comes to digital well-being as well. In addition, it helps us to put all these different strategies that I'm going to be presenting in a systemic and integrated way. Going back to Tori's wonderful metaphor of IKEA, how do we take all these different pieces around digital well-being and put them in an integrated way? It also helps us to make sure that we are doing this work in a data-driven manner, both by looking at to what extent is this an issue and how much progress are we moving the needle, so that the data helps us to determine that. And it just helps us to provide a great framework for identifying what are the gaps in programming and supports and what are the additional strategies we may want to put in place. And lastly, we know that there's evidence for effectiveness of MTSS. Next slide. So obviously on the left is your MTSS framework that we have been all talking about. And what I want to talk about now is some specific examples of digital well-being programs, practices, and policies at each one of these three tiers. So tier one, again, as I was saying before, all students can benefit from schools taking an approach to addressing digital well-being. The most common intervention of sorts that schools have been using, and that even state education agencies and state legislators have been talking about, is policies related to personal devices. So think about your own district. Chances are you have some sort of policy, especially in middle school and or high school. Some are starting even younger with elementary school policies that limit the amount of time that students can use any personal devices at school. So some districts go all the way from the bell to bell, absolutely no phones at all in the building or at no point during the school day, to some more flexible policies, such as, you can't have your phone during class, but you can have it during study hall or between classes. So all those different types of policies are already in place, and they're helpful. There is evidence to show that, in fact, when we have these policies, students tend to be much less distracted and do better in school by not having their devices right there in their hands. But there's more that we can do, and more than some of districts are already doing, and again, showing some evidence of success. Things like digital citizenship and media literacy education. So helping young people learn how to safely engage in the virtual world, in the media world. That goes to anything from understanding what information is real, how to test, how to validate information, especially now with the AI. There's so much fake information that is out there, or fake images. So helping students navigate that, become better consumers, but also to address things like online safety, knowing how not to provide your private information, any data online. All those kinds of things are important and can be provided through pedagogical approaches of actually teaching this in digital citizenship or literacy education. In addition, specific digital well-being kinds of strategies can be embedded through SEL or health education. So for example, things like how to manage my time, broadly speaking, and specifically related to my time on devices. So how do I make sure that I give myself only an hour to be on TikTok? I'm going to spend an hour just watching videos, and then I'm going to move on. I'm going to do my homework first, and I'm going to give myself a reward to go online. Those kinds of time management skills, but also relational skills. How to make sure that you're engaging in a very meaningful and productive way online with other people. That you're using online strategies and tools to engage people in a meaningful way. And that's simply by liking their pictures. And then the last one is positive school climate or online behavioral norms. So many of us are concerned about young people going online and meeting strangers and engaging with people outside of their real life world. The reality is that even online, kids are spending most of their time engaging with people that they already know, with their classmates, with their friends, engaging with them on Instagram or texting. And those kinds of behaviors that happen online can easily translate at school. So, for example, things like cyberbullying or kids, posting mean things about each other. That then comes back to the real life in school and can impact school climate. And so we want to be paying attention and connecting real life positive school climate with online climate and online behavioral norms to make sure kids are treating each other, their peers, online respectfully in a productive way. Next slide. So these are just examples of effective tier one strategies. We also want to, at the same time, pay attention to who are some of our students who might be struggling with digital well-being related behaviors or mental health conditions. So target supports are students who have additional needs. So, for example, small groups to help students who might need a better job managing their time, spending too much time online and not knowing how to balance between things like their homework time and other activities that are that real life, in-person activities with online behaviors. So having small group to build those skills is an example of a tier two strategy. Now you can have specific small groups like dedicated to this, or you can think about ways to integrate digital topics into existing student supports. So for example, students who are struggling with social behaviors and social skills in real life, you may have social skill groups, helping them think about, maybe there are ways to use digital tools in a positive way to engage with people. It might be easier for them to engage with people online first, to find people who are similar to them, who have similar needs, and engage in developing productive connections that way. Another type of strategy that is also tier two is peer mentoring. So thinking about how you can have, for example, cross-age supports, high school students supporting middle school students with any topic really, but in social situations, but also online, specifically for online behaviors. Some of my colleagues actually here at EDC have developed or are in the process of developing a specific cross-age support program for girls. Girls were identified as having some unique challenges around online behaviors. So they're looking at how older girls in high school can help either younger high school students or even middle school students with direct supports. Next slide. Lastly, tier three, we do know that some online behaviors and the consequences of these behaviors can in fact result in very significant mental health conditions, and or they can exacerbate existing mental health conditions. So someone who was already struggling with depression might have their online behaviors actually increase their depressive symptoms. And that might actually require actual counseling. So thinking about how to identify students who might be struggling and referring them to mental health services and treatment either in the building, in your school building, with your mental health providers, or referring them to specialized services outside the school in the community. And in some cases, when behaviors like indicating suicidal ideation online might require to actually help students, if you identify kids who are thinking about or talking about suicide or planning suicide through online channels, to actually work with them on developing safe planning and monitoring them for those very acute situations. So that's what we mean by tier three digital well-being. And really, both tier two and tier three, oftentimes we're talking about integrating digital well-being as a perspective, as a lens, as an issue to existing services and treatments. Next slide. I want to end by talking about, so how do you get started? So you might be thinking to yourself, wow, that's a lot of different interventions, a lot of different directions we can go to. Your mind might look like that image that Tori had early on with all the different interventions. And that's just for digital well-being, not to count all the other things. So there's some specific steps that we recommend at a district level and or at the school level. Start with establishing a digital wellness task force. That it's great to have mental health counselors, school adjustment counselors lead those groups, and can involve administrators, building level administrators. It can involve parents and even students themselves to engage in what are the specific issues, what are the challenges, what are the opportunities we have in our school. Let's figure it out and let's develop a plan. In addition to that is inventorying what are your current policies and practices. So what is your policy around personal device use at school? Are we talking at all about digital behaviors in our health class? Are we talking about it all in our civics classes? So really inventorying everything that you're doing so that you know where you're starting. And one piece of advice is you can inventory it using MTSS, the MTSS model to say, what are we doing for tier one? What are we doing for tier two and tier three? Once you do that, and that could be obviously the first task of the task force, once you do that, you can develop an action plan and say, here's what everything that we're doing now, here's how well that all our current policies and practices are doing to address our current needs. And here's what more we need to do and add things as we go. Because thinking about doing it all at once might feel overwhelming. And then next, align what you're doing with policy. Make sure the policies are aligned with the actual curricula, with what is being taught across different domains, and that you're supporting your staff to implement policies or to teach the curricula, so that you're not just putting policies in place without helping your educators know how to enforce them or how to best navigate through them. And lastly, we talked about data and the importance of data, using data for continuous improvement to see what is the extent of the challenges we have and are we making a difference? And that can be done through surveys, it can be done through focus groups, it could be done by looking at existing data around attendance, disciplinary behaviors, just seeing if to what extent is digital well-being coming up as a root cause of some of those behaviors that are documented through data, and then using that same data to see if you're making a difference. So that's our short description of how to use MTSS for digital well-being. There's more information in the fact sheet that I mentioned before. And with that, I'm going to pass things back to my colleague Summer, who's going to talk about applying MTSS to suicide prevention.
Thank you so much, Shai. So like Shai said, we're really just going to shift gears now to talking about how to basically apply a multi-tiered system of support specifically to suicide prevention. So as you all know, and as we've been talking about today, MTSS really does provide you with that structure for organizing, prevention, and all the different things we've been talking about today. But specifically, when we're looking at suicide prevention, MTSS can really just help you to structure your organization and your school around prevention, early identification, and intervention efforts. And as you all know, suicide prevention is and should be a critical component of your student mental health systems. Next slide, please. And as Shai was also talking about earlier, we do have our recently published fact sheet about all of the different MTSS approaches to implementing effective suicide prevention that, of course, we will be sharing today. And it also just takes some time to highlight some of those key findings and practical implementations from that resource during my time with you all today. And just to give us kind of an overview of how concerned we need to be about youth suicide. So this data comes from the CDC's Youth Risk Behavior Survey. So it is a national sample of suicide risk among high school youth. And this is from 2022 to 2023. And recent data is really just showing here that there is a substantial portion of high school students reporting suicidal thoughts, plans, and attempts. And these numbers really just highlight that suicide is a significant public health issue and ultimately an educational concern, since based on this data, based on conversations y'all have probably had with students in your lives, students you're working with, this is definitely not a rare or isolated issue. That's why it's really important that we're integrating suicide prevention and having these conversations, especially when we're thinking about those comprehensive approaches. And we ultimately believe that schools are uniquely positioned to play that preventative role when it comes to suicide prevention due to the daily contact you have with students, the ability to identify some of those early warning signs in suicide that can be really helpful. And of course, stopping an attempt, stopping deaths, preserving life, of course. Then also just the importance of schools and the role that they play in building those protective environments that we all know reduce and prevent risk. And looking to why you should apply an MTSS framework for suicide prevention, of course, as you all know, it's very important that in order for us to be effectively meeting the needs of all of our students, we really need to, whether it's through that MTSS model or through other ways, really be addressing the needs of all of our students across levels, no matter, of course, how they're showing up. And to do that, we really do need to be using a comprehensive response. And of course, that MTSS framework really allows us to do so. And just speaking from the suicide prevention side, also with all of the data and research that we have about suicide prevention, we also know that suicide prevention really does require that more comprehensive, coordinated, systems-wide efforts. We need to be going beyond those one-on-one gatekeeper trainings or isolated programs to really be embedding suicide prevention into that systematic, integrated approach that are involving all members of the school community. And that's ultimately all just to say that MTSS can really help us to understand how suicide prevention plays a role in, of course, enhancing youth care by giving us that data-driven framework for helping identify students at risk and, of course, prioritizing protective and responsive strategies. So overall, an MTSS model that is aligned, of course, with suicide prevention can really help you to align, sustain, and ensure that of course, your efforts in suicide prevention within schools remain consistent no matter the school or the district. And just to give you a bit of information about how we at Education Development Center understand kind of MTSS apply to suicide prevention, we have our multi-tiered suicide prevention for schools model. So essentially, this ultimately just argues that a multi-tiered approach for suicide prevention is most effective when it's integrating both all of prevention, early intervention, and interventive responses into a single coherent system. So as the slide here says, school suicide prevention is most effective when it brings together a variety of prevention strategies to prevent students in distress, again, really making sure we're capturing all of the needs of all students in our school districts and systems. We're supporting youth who are struggling, whether it be folks who are maybe not at risk yet, but we're doing things like protective factors, whether, and of course, I'll spend some time kind of looking at different strategies across tiers. And then finally, really making sure that we're having care for a school community after loss, because we ultimately do believe that providing follow-up resources and postvention is ultimately prevention, because of course, we are working to reduce risk for further incidents. And all in all, to say this MTSP or multi-tiered suicide prevention for schools model is based off of a multi-tiered systems-wide approach of 6 key components for school-based suicide prevention. We don't have time to walk through each component today, but it is linked here in the slides. And ultimately, this framework really just emphasizes the importance of reducing risk factors for youth suicide and, of course, strengthening those protective factors across the school community. And just to give you some examples of how suicide prevention shows up across those MTSS tiers, of course, at the tier 1, we're really focusing on those protective factors. So looking at things like school-wide and classroom-wide practices and culture that promote well-being and protective factors for all students, including any activities and conversations you're having around engaging the broader school community, like community partners, and of course, bringing in parents, guardians, different cultural liaisons, things like that. Also, when we're looking at protective factors, just pulling on some of those best practices that are outlined in more detail on that fact sheet. Of course, schools are doing things at that universal level, like strengthening school connectedness, really making sure we're having things like positive behavior norms and building up those supportive relationships. Some other universal or school-wide efforts you will also see is doing things like teaching coping skills, modeling how to manage stress, how to deal with both those day-to-day things that may happen or even those bigger things that are happening in lives. Really thinking through how to make healthy decisions, and of course, really modeling and showing how to ask for help and that it is okay to ask for help, and of course, reducing some of that stigma that is around mental health. And then also really important when it comes to tier 1, especially for suicide prevention, the importance of having things like professional development for staff, not only so staff understand the role that they play in youth suicide prevention based on their role, but also that they're able to take trainings, things like gatekeeper trainings that will teach you the warning signs and risk factors for suicide, just so they feel safe and equipped to be able to recognize some of those signs that the youth that they're working with may be demonstrating, and that they're able to also follow and establish those protocols and procedures, which we'll talk about in a bit. So looking at the tier two, again, this is really focused on those students who have already been identified as being an elevated risk for suicide. So speaking again to those protocols I just mentioned, one really important thing at this tier two level is having some sort of crafted written policies for identifying and intervening with students who had risk for suicide. And this is really important because it's really going to help staff as well as students and families understand how staff and which staff, depending on their role, are really responsible and are really ready to act on any youth suicide risk within a school setting, and ultimately how that is outlined in the different steps that staff should take to, of course, mitigate suicide risk should really ultimately be determined by the school's written suicide identification and response policies and protocols. That's why it's really important to have that in place, especially before risk is ever present. Some other things you may see at the tier two level is, of course, things like suicide risk screening tools that can really help you to identify students who may need some additional support before a crisis occurs. And oftentimes, those students who are identified through screening are connected to some of those target school-based mental health supports, like the ones seen here, such as small groups or those individual counseling. Then, of course, when appropriate, oftentimes schools are going to work with community partners and families and other settings to really ensure that if the level of care or the services are not available in school or a student's needs are higher than can be met at school, folks like community mental health providers or local community organizations that focus on mental health can, of course, be able to support that student. So also, of course, referrals to those outside supports just to make sure you're maintaining that continuity of care. And just a quick note here before we go on to tier three, I just wanted to make a quick note on like parent approval. So whether or not staff need to get that formal parent approval before conducting a suicide risk assessment really ultimately depends on the school. And again, that's why it's really important to really be outlining the role based on your role, whether you're a mental health professional or an educator or a paraeducator, and whether or not and when you need to, of course, get parent approval before doing any of those student-based questionnaires. Then moving on to tier three, again, these are those intensive, individualized interventions for students experiencing acute suicide risk. So at this level, it really looks like things like suicide risk assessment. So these are assessments that should really only be being done by licensed mental health professionals who have, of course, been trained to conduct these suicide risk assessments. And ultimately, after someone has been screened and they have a positive screen, they'll move up to that tier three. That licensed mental health provider will sit down with them to really understand that student's level of risk and what are their immediate needs. And again, that's why this is very individualized because every single student probably needs a different approach depending on their level of risk and need. Also at this level, we see schools implementing their crisis response protocols just to ultimately ensure that we're having that timely, coordinated action and response when a student is in danger, including, again, any coordination that may need to happen with any outside community partners to, of course, get students the help that they need. And as I was touching on earlier, Tier 3 also includes all of those post-vention strategies for supporting a school community following a youth suicide attempt or death. And very similar to what Shai went through, just some of our best practice getting started tips to looking at your MTSS, especially when it comes to suicide prevention. Again, so first, really the importance of having those written protocols, so establishing and training staff on those protocols once they're developed and being very clear to define the roles and the responsibilities of staff so they're ready to support whenever, of course, risk is present. Of course, the importance of creating protective environments, so things like promoting coping skills, help seeking, anti-bullying, and really working with both the trusted adults in the school building and anyone in the wider community to build those strong connections with youth, because of course we know having that positive school environment can ultimately reduce youth suicide risk. And then finally, of course, first understanding what is even available in your area, letting families, letting staff know what is available, and really working to strengthen those relationships with those external mental health providers so schools can have that access to intensive supports during a crisis. And then finally, just to share a quick resource with you all in the next slide. This is our MTSP assessment and companion guide, and essentially very similar to what Shai was speaking about earlier. This freely available guide, which is available on the link here, you can really sit down with your school teams to understand what is currently in place related to suicide prevention, mental health, and life skills development at your school. And then this companion guide would also just help you to understand some of those contextual, real world, and best practice considerations for all of the items and their rankings. And there's some really key like best practice resources as well at the end. But this is a really great resource for you to kind of understand where you currently are as a school system and really work to think about what are those missing key components you can start to work on. And yeah, I think we're going to move into our Q&A.
Great. Thank you so much. And thank you everyone who joined us, rejoined us. We've been collecting your questions and comments, and I know we are a little bit short on time, but I did want to try and get a couple questions out to everyone. Okay. So, Tori, I'm going to pose the first question to you, and that is a question that we received earlier in the presentation. How do you balance providing and supporting community-based services and ensuring school support within the advanced tier space?
That's a great question. I think it really is going to be dependent school to school on how many community-based resources you have access to and relationships with. There are tier 3 supports that are entirely possible to provide within the context of a school. One-on-one counseling is a great example of a support that would be considered a tier 3 support, one-on-one sessions with the school counselor or the school guidance counselor. So if you are not a school that has a lot of relationships with outside support, you can provide tier 3 supports on your own. However, if you do have relationships with external mental health supports, local counseling centers, youth peer groups, things like that, that is an opportunity to reach out and connect with those different organizations to provide tier 3. So really it's a school by school balance that you create as you're designing your MTSS for your school context.
Awesome. Thank you so much, Tori. I have a very specific question that I'm going to ask of you, Shai. Do you have, and I know that the links to the fact sheets were just shared out during this webinar, but any recommendations and research that can help guide SEA and LEA policies on digital and personal electronic devices in schools?
Yes. First, a great place to look for policies for LEAs is your state-specific school board association. So many school associations, school board associations will have examples of policies. I know for a fact, I live in Massachusetts. I've worked before with Connecticut. Both Massachusetts and Connecticut associations of school boards or school committees, as we call them in Massachusetts, have sample policies. So I would go there first, and not necessarily to Massachusetts, Connecticut, but to whatever your state is to see sample policies, just because so many districts are working on them. In terms of SCAs, I know a lot of states are now in the legislatures are now in the process of putting in place state level policies. I don't have one specific resource on, for example, North Carolina recently passed a law. We don't know yet the research. So in terms of knowing what policies are effective, it's hard to know. But we know they're out there, both at the state level and at the local education level. So it's a matter of finding what other states or other districts are doing. But again, the research is a little bit lagging in terms of what specific policies work.
Great. Thank you, Shai. So this next question actually involves both. Both you, Shai, and also Summer, and Tori, feel free to weigh in as well. But we had an interesting question, I thought, and I'm not sure that you'll have this information on the tip of your fingers, but the participant was asking whether you can discuss the use of AI tools in promoting digital well-being and preventing suicide. Do you want to take it first, Summer? I saw you nodding.
Yeah, no, of course. Of course, there's been a bunch of different conversations and things around like AI and suicide prevention. I know a couple of organizations have like issued position statements, but I feel like overall when it comes to AI, like a lot of the resources and things specifically for suicide prevention are a little bit limiting at the moment just because it's so important to have like that human connection and aspect, especially when it comes to like risk and assessment. But I do know there's been some developments in things like safety planning tools, so helping folks to kind of do more of those lower intensity based interventions and really helping folks to identify what are your coping skills you can kind of refer to when you're going through different things. I know a few of the school teams that I've worked with also have different things like power schools or some others that I'm not remembering off the top of my head that kind of allow students to like send a quick message to their counselor or to different folks. And I know they have like AI kind of built into that. So if the AI like flags any certain language, it then elevates it to a certain counselor or someone to then reach out to that person, of course, in person. And I feel like that's been the most effective based on like research and the things that I've seen. Everything is really, of course, paired with that human intervention because it's really important that we're having that like warm follow-up and care just so folks know that there's hope and there's resources available to them.
Thank you so much. That's great. Shai, anything you want to add from the digital well-being space?
Yeah, the one thing I'll add in general about AI products to help support mental health is it's mental health is best provided and addressed through human interactions. However, AI can be helpful in identifying students who are struggling. So, for example, I know there's some products out there that districts can purchase that use AI to identify dangerous language in social media apps being used on campus or texts. So using AI to detect when students are using language that might uh, uh, indicate, suicidality or, hurting someone else is helpful to detect needs. But at the end of the day, I would always have the human address it.
That makes sense. So thank you very much. I apologize that we've run a bit short. We are actually over time right now. I know there were a lot of questions about resources. I'm certain that we're going to share links to all of the resources that were mentioned today with the participants who registered for today's event. So I would love to say to be continued. We're very excited that there's been so much information and interest shared today. So before we close, I do just want to mention that we are um, going to have a survey come up, and we really do encourage people to participate in the survey as it really helps us in designing and delivering events like these for the future. So a link is going to go into the chat if it hasn't already, and it will also auto launch once the room closes. But for now, thank you so much for joining us today. We are very pleased with the engagement that we saw in the Q&A. I apologize that we didn't get to all of the questions. Thank you so much to all of our presenters, and we will be in touch with the links and slides after the event. Thank you so much.